It's up to us, all of us. The safety of our communities is in our hands. The police need our help and support. Boko Haram threatens our lives, our future, our country. But Nigeria belongs to us. God has blessed us with this rich land. Let us protect her as we protect each other. Report any criminal activity. Call these numbers. Your call is anonymous, and it is vitally important. Your support so far has been critical. Continuing it will make all the difference between a Nigeria of the fearful and a Nigeria of the free. Protect each other, for we are not terrorists. We are Nigerians. A message from the State Security Service.
Morning, and thank you very much for joining us. I am Yori Folani. Now, we haven't spoken about monkeypox. There's also chickenpox. There's also cowpox. Thank God we don't have those ones. Not a matter of yet, we don't have those ones. Even the monkeypox itself, so much has been said about it. And even they created some sort of a scare about it, so much so that parents, in some instances, actually were withdrawing their kids from school in a panic. The thing is that the problem with monkeypox is medical science tells us that there is no specific treatment for it as we speak. And so what you can do is you can contain it, you can contain the spread of it, but as of now, doctors have said that it will, spend its course and die out. But it's worrying because we started from it being present in 7 states, and they were talking about 33 cases nationwide in 7 states. But then the Minister of Health, Professor Isaac Adewale, has updated that figure, those figures. So we're now talking about 11 states and 74 suspected cases recorded by this October. Okay, my guest is a public health expert, Dr. Emmanuel Oga. Thank you very much for coming on the program. And Barrister, well, I shouldn't have said that, but since I went and put the doctor, I don't know, Mr. Kolawole, Mr. Tunde Kolawole, lawyer and public affairs analyst. Thank you very, very much for coming on. Indeed, if there are, human rights aspects to all of this, we shall find out. Now, the thing, though, is that there's been some sort of a politicization attempt in the midst of this whole confusion over monkeypox. Monkeypox, doctor, is common knowledge, why it's called that is that was where it was first discovered. But tell us a bit, before we go into, about these zoonotic diseases. Just tell us a bit about how easy it is, because our people work in the farms, we work with wildlife, we work with animals, and what people didn't think. Maybe just tell us, is it the only zoonotic disease that virus that we have? I beg your pardon?
No. Actually, we.
Oh, sorry. By the way, zoonotic, transferring from animals to human.
I understand.
Just for the viewers, because I looked that up myself, not being a doctor, so I just had to share it with them.
I understand. I was just about to come up with that. Yeah, it's actually not the. There are a lot of viruses that could be transmitted from animals to, but of course, in this part of the world, they are not. We don't have them common around, like the monkeypox. Even the monkeypox you're talking about is just it came on board in 1970 and somewhere in the Democratic Republic of Congo. And from there, we had, in 2003, we had it in United States, an outburst. And then,
it's similar to the chickenpox that humans are known for, but it's a different strain, right?
Yes, similar though, but chickenpox is kind of more fatal.
Indeed.
It's more fatal because I can tell you that mortality rate is almost 0 when it comes to monkeypox.
Monkeypox.
Yes, but when it comes to chickenpox, you have it more.
It can be quite serious.
It can be quite serious.
So it's said to be a much milder version of the smallpox, chickenpox and
very
smallpox,
correct.
and that quite frankly, there is no known treatment. It'll have to run its course.
Yes, it has to run its course, and that is why when it comes like this, as I talked to you, the World Health Organization, in conjunction with the Ministry of Health in each of the states, they are putting up isolation centers, ensuring that once it comes, individuals that are suspected to have them, they are highly quarantined or immediately quarantined, so that it wouldn't spread to other individuals. So for now, there is no any medical treatment, known medical treatment, though researches are ongoing. And in that direction.
So, but when people in the science community, in the medical community, say that you can't, there is no known treatment for it, or as we speak now, but at the same time they say you can limit its spread. Is it by what you just described, quarantining people away?
Quarantine people,
so it will run its course.
There are some standard measures in the medical field that if you keep to such measures, of course, risk factors will be reduced, and you're likely to avoid further spread of such endemic.
But since we had a spread from 7 states to 11 states, from 33 known cases to 74 known cases, it therefore means that in this particular method that you're talking about, perhaps it wasn't done as efficiently as it could have been done.
Not like it wasn't done efficiently. You know, cases like this, when they come up, you in sciences, you have to verify, take to lab and be sure that this is happening. You know, the first thing, usually it looks like a rumor until it is verified in the lab. So can we say possibly actions were not taken on time? But I can assure you as it is that the concerned agencies and organizations, they are on top of the job, ensuring that it curtail further spread of the virus.
And then staying with you for a moment more, Doctor, the way this thing has spread, now they even included in the southwest here, even Lagos. And the minister spoke about suspected cases, but then were found to be negative when investigations. But so that goes back to what you've just said, that one needs to really interrogate and be very sure as to what we're dealing with.
One more thing is that the symptoms of monkeypox, they're so close to the chicken pox. You know, chicken pox is what we have all around. You have to be very careful to know, to be able to differentiate between the two. You know, of course, if you talk about chicken pox and the monkeypox, the initial symptoms, which is severe headache, fever, back pain, and all of that, they are there. They are similar. Yeah. But when you begin to know that this is monkeypox and this is chicken pox, is the maturedness of the bombs, of the rashes. You know, when it comes to monkeypox, it comes out in full force and all over the places. But in chicken pox, there is a reduced level of the rashes, and it's not up to a bomb, you know, but it's there. You understand what I mean? So that is. And
you've said that we've said it's zoonotic. It can come from animals to human. But in what way? Some biting, fluids of the animals, those kind of things?
Yeah, particularly fluids. You know, most of these animals, they have sores, lysins all over their body. So if you allow the secretions to, you know, you come in contact with the secretions, it become highly contagious. And it can also be contacted if you are treating a patient that has been infected.
So now there's a human-to-human jump.
Yes, there is also a
First of all, it jumps from animal to human, and then it's possible for it to jump from human to human.
You're very correct.
Oh.
Yes, very correct.
And so those that would be at greatest risk, I would imagine, is maybe you have monkeys as pets, or maybe you actually, it's part of, you eat monkeys. Maybe some people, some communities.
Yes, the name of the virus is called monkeypox, not because it is only found in monkeys. It was actually first
found in a monkey. And that's why it took the name.
Yeah, you can get it through rodents generally, squirrel, rats, antelopes, and what have you. Yeah.
Oh, I see. And it will present as that which we now know as monkeypox.
Exactly. So what
So
we are
it
saying,
might have come from a rodent, but
yes,
it is still monkeypox.
it's monkeypox.
I
Yeah, it's monkeypox because it was found first in monkeys, and then it was later discovered medically that it can also be contacted through secretions in other affected animals.
Although it's not our main concern now, but does cowpox come under the same general kind of things you talked about?
Yes, it does.
It's generally like that
generally
too.
like, yes.
And again, perhaps cowpox too will not be exclusively found only in cows.
Yeah, no.
I see.
Well, that has not been medically verified, but...
So let me not extrapolate too much.
Yes.
Let's just limit ourselves to the monkey thing. Okay.
Thank you very
so
much.
So that I can go to Barrister Kolawole. The other aspect that I want you to help us with is that this crazy rumor, that's what I thought it was, that, well, the army is now trying to vaccinate us to death because of political reasons. What was it? Now, first of all, just the science of it. What, somebody would go and get the virus, put it in a syringe, then go look at some hapless individual and inject that virus into that person. I mean, I'm just looking at a totally crazy scenario. That's the way that any diabolical, wicked person would spread this?
Well, let me at this point establish the fact that we have come this far as a nation due to government support, but basically the doctors and the army. You know, we have been able to sustain the health and other aspects of this nation because of the contributions we've made so far. And when we talk about, from what I read from the documents that was available to me and what I watched, the army were just doing their usual corporate social responsibility, which as an expert in public health, I'm very much aware of that. It has come to be that every year they undergo such medical corporate social responsibility. So I begin to feel that some mischievous false newsmakers are up to something in that this thing. And
because as the Minister of Health explained,
yes,
it's perfectly normal, and it has been going on, as you've just pointed out,
yes,
for a while. The army helps get to some areas,
yes,
some far-flung areas that are otherwise not easily accessible. So the army has always been a partner in this exercise, and the point has been made that the army never leads. That, you know, the army never leads in this exercise is what we've also heard.
Yes.
That the state, wherever this thing is going on, it is the state that takes the lead, you know, and the army just really just sort of facilitates the whole thing.
Yes. Like a place like Anambra State, where the issue almost took a toll on the nation. I think when it started, the governor intervened, you know, through the office of the SSG. And before you know, the army being a law-abiding organization, they put a stop to the process so that when they, yes, to avoid any kind of confusion. So if somebody have that ulterior motive has been speculated, I don't think such intervention would have worked timely the way the people are pushing it, the mischievous newsmakers are pushing it. So I want to believe that we should try as much as possible to, you know, look out for those such people that are, you know, putting the rumors around and ensure they explain to the nation properly the source. Indeed. The source indeed. You know, I will not completely say that they are wrong. Because, you know, we live in a nation where you can concoct something and then just bring it up, you know. But as for me, medically...
I was going to say you can completely say they are wrong.
You know, no, you know, it's...
you're still allowing some merging, imagine.
They are wrong, actually. They are wrong. They are completely wrong.
They can't be wrong.
They are wrong. It's not... it doesn't have any medical backup. And if you check the way and manner the armies have conducted themselves since this administration came on board, I think they have really shown that they are in for the people. So for somebody to just turn around one afternoon to say that these people are injecting a particular vaccine for, what do we call it, monkeypox. I think it left a lot to be desired.
Okay. Tunde, what do you think? Because, well, you and a lot of colleagues of yours, you know, defenders of human rights and that.
I don't think such intervention would have worked timely the way the people are pushing it, the mischievous newsmakers are pushing it. So I want to believe that we should try as much as possible to, you know, look out for those such people that are, you know, putting the rumors around and ensure they explain to the nation properly the source. Indeed. The source indeed. You know, I will not completely say that they are wrong. Because, you know, we live in a nation where you can concoct something and then just bring it up, you know. But as for me, medically...
I was going to say you can completely say they are wrong.
you know, no, you know, it's...
you're still allowing some merging, imagine.
They are wrong, actually. They are wrong. They are completely wrong.
They can't be wrong.
They are wrong. It's not... it doesn't have any medical backup. And if you check the way and manner the armies have conducted themselves since this administration came on board, I think they have really shown that they are in for the people. So for somebody to just turn around one afternoon to say that these people are injecting a particular vaccine for, what do we call it, monkeypox, I think it left a lot to be desired.
Okay. Tunde, what do you think? Because well, you and a lot of colleagues of yours, you know, defenders of human rights and that kind of a thing. But the whole hullabaloo about injecting our children and parents taking children out of schools, I imagine people in the human rights communities have to have their own ways and means of checking the veracity of any situation before they wade into it, I would imagine. And sometimes maybe even from people taking their complaints or their fears or their apprehensions to the human rights community, maybe that's a layer where they could probably further be educated. Or what do you think? How do you see it? Or does the layer just swing into action because, you know, one parent has complained that they want to kill my child?
Definitely not. Definitely not. When you look at the Constitution of the Federal Republic of Nigeria in 1889, you will find out there are a list of fundamental rights that is guaranteed by that Constitution. For example, when you look at Section 33, for example, it talks about right to life of every citizen of Nigeria. A man or a woman can only be deprived of the right to his life through the due process of the law, when the court has so pronounced, especially in capital offenses. Otherwise, whether you be army, whether you be civilian or whatever, you cannot go in anywhere. And then introducing viruses that has the capacity to,
but nobody has ever done that.
Kill some other person. No, it
do we have a
precedent?
Unless we are going back to anti-Semitic experimentations in World War II.
Even in modern times, we've had such strange cases. I will recollect sometimes in the U.S. when the civics vaccines was first funded. The blacks were being used as guinea pigs in the U.S. to really test the efficacy of that.
But locally,
here in Nigeria, too, don't forget, there were times, I mean, not too long ago in our recent history, in which a pharmaceutical company, I think in Kano or Kaduna in the north end there, were testing some drugs and all that. And
that they had to withdraw.
And that drug killed a lot of young children in those places and all that. At the end of the day, I think that pharmaceutical company had to pay compensation to some of these people. So the people...
So you couldn't blame the people?
No, we could not blame them. We could not blame them. But we still have to be wary of the way and manner these things spread like wildfire, in the sense that here we have an army that has been a responsible army over the years in humanitarian services, in constructions, and some of these other things. Even not too long ago, when they were said to be conducting certain operations very close to Nnamdi Kanu's house and all that, they also embarked on some medical outreach programs for the people of that localities and all that. And the people applauded it, and they were happy. They benefited. And you also remember that, just like a doctor said, opportunities like this are good occasion to really give these young Nigerians, especially the children, certain vaccines that are not readily available to them, polio vaccines and some of these other things. By the nature of this propaganda, we have invariably denied these children who would have otherwise benefited from some of this. And it is also not the first time we are going to be seeing this in this country. You will recollect there was a time in which the vaccination of people against polio, children against polio, became an issue in the north. Yeah. In which somebody like Dr. Dati Ahmad, who is supposed to be a medical doctor, went out and said, look, those polio vaccines were being made from extras from pig, and the Muslims are not supposed to eat or have anything to do with pigs. And the children, parents should not allow their children to be given this polio vaccine. And then a lot of children, a lot of parents had to withdraw their children from being vaccinated against polio. Whereas I and you do know that the allies in the north will go back behind to the private medical hospitals and some of these facilities and give their own children this polio vaccine and some of these other vaccines that will insulate them from some of these childhood diseases. But when it comes to spreading propaganda, when it comes to these their intra-class fightings and other, they come up with this propaganda to mislead the people. So the summary of what I'm saying is that we should see this as a propaganda. And you see, when lie is traveling and then we keep on regurgitating it, it tends to take the coloration of truth. And that is why we must, as a nation, be very, very careful in assisting those who have embarked on this propaganda to smear the Nigerian army. It's a very, very uncharitable. Indeed. Here is an army that is being sacrificing his life, curtailing the Boko Haram, making a lot of efforts in the Niger Delta.
This is where politics is coming into
very dangerous politics.
Indeed, very, very dangerous politics, because it's, well, again, unfortunately, this goes back to education again, but that's the subject of another program. You see, the more enlightened and the more educated we are, so we can access information, we can cross-check information speedily. So sometimes a rumor doesn't even have the chance to get off the ground. But unfortunately, it would get to the required altitude to begin to do damage before we now move in and we begin to do damage control. But doctor, back to the scientific aspects of this, unfortunate outbreak. Mr. George, good morning. Thank you for calling in.
Good morning, Uncle Yori.
Thank you for calling in. Good morning.
Thank you, and also good morning to the guests.
Okay.
Good morning,
Uncle Yori, I'm sorry to say that I'm personally not impressed by the performance of the health minister. First, it was cerebrospinal meningitis that broke out in the north. It took more than 1,000 deaths to happen.
Yeah, that's the one you were talking about.
That disease was controlled. Lassa fever came, the same thing. Chicken pox, what do you call this one now?
Monkeypox
has come. It happened only in Bayelsa State. It was not contained. Today we are now talking about 11 states. What kind of Minister of Health is this? Personally, I am not impressed. It would appear that the Minister of Health has passion for education instead of health, because he was a VC of a university. If I were the president, maybe they should move him to the Ministry of Education and let somebody who has passion for health control that ministry. When Professor Rason Kuti was Minister of Health, he brought his passion for child, child medication. So what he was doing, I'm not seeing this in this minister. Nobody has seen him visiting a quarantine center to see how it is being done. Imagine if Ebola had broken out in Abuja. When Ebola broke out in Lagos, we saw Fashola, who is not a doctor, how he was proactive, how he tackled it. But we have a Minister of Health that doesn't seem to leave his chair. Is it the military? Is it in the place of what the military is doing now? Is supposed to be done by the Minister of Health.
Okay.
And we are seeing soldiers doing what the Minister of Health should be doing. Personally, I'm not impressed. Thank you, Uncle Yori.
Thank you very much, Mr. George, for calling in. Dr. Oga, what do you think about the reaction time, our reaction? Actually, the question I was going to ask, but you might as well ask this one that I was going to ask this matter of doctors saying it has to run its course. I was going to ask, first of all, what is the framework, a sort of a guideline? Are we talking about 12 weeks? Is it 6 weeks, whatever? But then after that, I'd like you to comment on Mr. George's reservations that we didn't move with enough agility or indeed timeliness.
Okay, thank you very much. Yes, let me say that as I speak, samples have been sent to, we have the monkeypox highly dominated in Senegal. So a lot of researches are going on there by World Health Organization and other related organizations to see what can be done quickly at that level. Of course, whatever that is done there, of course, will affect Nigeria too as a nation, because there is synergy when it comes to health. And you see, when we talk about outbreak like this, each disease in medicine have what we call pathophysiology. The pathophysiology is the pathway for the treatment. You know, they are not the same. The pathway for a particular treatment of a disease, which the medical expert must ascertain before making a statement. Some will take up to 2 weeks. Some will take just a day. By the time you study, because the person of a minister of health coming out to say, okay, this is what we are going to do, without actually knowing the pathophysiology of this, it's going to, at the end of the day, tantamount to, you know, you understand what I mean. We are a country that when we don't get it right at once, it's always a problem. We have to go back again to begin to.
And then you
so
go back to ground zero.
While I am not here to like support whatever delay that have been observed in this, I also want to say that you cannot completely blame the Honorable Minister, because
there is a scientific process.
There is a scientific process to all of this. And believe me, he must have taken his time to do that before coming out. And like the issue of Ebola, it took us like 2-3 days, and the statement of fact was arrived at, because the pathophysiology was studied, and then they arrive at what should be done at a particular time, and it was really done.
Okay.
So what I am saying in essence is we should give a space, and let's see how far we can go. But I can assure Nigerians and all listeners that the Ministry of Health and the World Health Organizations and all the related organizations, they are really on top of the situation.
Mr. Isiaka in Boko, Benue State, thank you very much for holding on. Are you still there? I got my answer. I'm so sorry about that, Mr. Isiaka calling in from Boko in Benue State. I'm so sorry that we couldn't get you. See if you can call in again. I'll come to you immediately. You probably understand Dr. Oga was saying something important, and I had to, you know, not lose any of that on your behalf. Well, I think it's always useful to have the, shall we say, the core perspective, because it's one thing from a current affairs point of view, or from the way we would want it to be, but if there are processes, then we need to know these processes. It probably also informs why you didn't comment on, since we say this is a virus that must run its course, how long is that in the worst case scenario?
At least we're looking at between the 1 to 12 days. You should have been able to ascertain what to do. Okay,
one moment please. I just got Isiaka back. Good morning again, Isiaka, and thank you very much for calling in.
Good morning, Uncle Yori.
Please go ahead, sir.
My first time calling.
Indeed, thank you very much.
I've been trying to reach you all this while. Today that God help me, I get you.
We're delighted. We're delighted you got in.
A very nice job. I appreciate that. You see, federal government are not helping matters in issue of monkeypox. Seriously. There is no intervention. When you come down here, people are not aware of it. I'm telling you. And let me tell you, this axis of...
You're talking about Benue State? In Benue?
Hello?
In Benue? You said people are not aware in Benue?
People are not aware. There's no much sensitization like that. People do not know much about it. You understand? But when you are... Yes, Uncle Yori. When you are telling them about it, they will say, what is this monkeypox? What is monkeypox? And we have a kind of high rate of consumption of bush meat, even monkey meat. I'm telling you, but much of our rural area inside here, they're not aware of it. Federal government are not helping matters. I expect that even the state government should liaise with federal government so that they will give awareness. You know, like that happen.
Isiaka.
Hello?
Isiaka.
Yes.
You are in Benue State and you are aware. When you say you don't think a lot of people in Benue are aware, is it to say that they don't have access to radio, TV, press, even if government isn't doing as much as they could be doing? You are aware. How is it that you think that awareness is very, very low in Benue?
It's very low, exactly. But aside from that, you know, we have a... Hello?
Yes, we're here. We can hear you.
You see, we have state radio stations, state television. They are not hearing it.
Okay.
You understand about? It's a private platform I'm watching. I know about it.
Okay.
BBC. How they getting what I'm saying? I expect that there's some kind of FM that you know about that they speak in a local dialect of that particular environment. How they getting what I'm saying? So that they will know about it.
Okay.
But none of that. None of that. I'm telling you, none of that. So at least I expect the federal government and state government to do more in that.
All right then. Thank you. Thank you very much for calling in. Appreciate your call and also the effort you made to get back to us. Yeah, I think you settled on, you know, it's variable.
Yes.
But now, unfortunately, okay, I've got to go on a commercial break. Okay, let me quickly do that so that there won't be any further interruptions. Stay with us. We'll be right back. Welcome back. We got Dr. Emmanuel Oga, public health expert, and Tunde Kolawole, lawyer and public affairs analyst. Thank you for coming, gentlemen. I want to return to something you said at the top of the program, Dr. Oga. You spoke about the way when it is full-blown that it manifests, you know, the unsightly bumps, you know, much larger than people even know, as you were saying, with chicken pox. Yet it is much milder. Fatalities are almost zero. But were you saying off air that actually there's more than one strain of monkeypox?
Yeah, there is. We have the Central African strain of monkeypox, and then we have the West African strain. And the Central African one is more fatal, more disastrous, and we don't experience that in this part.
Even though it is, as you have said, generally milder than chickenpox,
yes,
or smallpox.
No, smallpox, yes.
But still, the Central African one
is just like HIV. When we have HIV 1 and 2,
I see.
Type 1 and 2, you know, we have 1 and 2 of this. The one is in Central Africa, and the prevalent one here is West Africa. And it's next to zero mortality that we have experienced in this. Okay. You know, it will run its course. You know, the high fever, the pains and all of that, then the giant bombs looking scary, the welcome, but it also...
It looks a lot worse than it actually
when
is.
you are quarantined in the isolation centers with time, with the council and from experts, epidemiologists and the rest of that, it goes.
You bring it under control.
Yeah.
Okay, Mazi Okorafor, good morning, sir. Thank you for holding on.
Yeah, good morning, Sayuri.
Thank you for calling in. Go ahead, please. Did we lose you immediately, Mazi? I think so. I think we did lose it. And the point has been made that it's called monkeypox because it was first found in monkeys.
Yes.
But actually, rodents.
Generally.
Mazi Okorafor, I understand you're still there. Good morning, Mazi.
Yeah, good morning, Sayuri.
Okay, carry on, please.
You said you asked your guest about cow meat monkeypox. He said no. Now, if you go to YouTube now, as I'm talking to you now, you see that people are saying don't eat cow meat because of the monkeypox virus. Now, that will show that Nigeria is a country where illiteracy dominates 70 to 80%. And the government are aware of it. And like what Mr. George just asked some minutes ago, what is the Ministry of Health doing? I think somebody from Benue was talking about the local languages and the rest, which is very, very necessary. Now, you ask yourself, common malaria.
I think it's the network. The network seems to be drifting in and out. For all we know, you still might be on the line. It might well be that you can still hear us, but I think we've lost this connection. Okay, again, back to you, Dr. Because the gentleman from Benue State, Isiaka,
yes.
Is there someone on the line? No. he was complaining that, look, he thinks enough hasn't been done, especially in the local languages. Are there other aspects to consider in coming to a sort of a judgment that not enough is being done, or we're not being informed enough?
Yes, we are a very versatile nation, and I can assure you that we'll keep doing enough and enough. And when you have even done the enough, it will still not be enough. So what we'll tell the public is that this thing works even more better when it comes to a door-to-door thing, you know, and listening to programs like this, and also to the government. We also advise that they are doing a wonderful job, but we, just as we say that the enough is not enough, they should still do more to, you know, especially in the area of letting the public know that it is not what they hear on the first line charge that they will listen to. You know, just like he was complaining that and now people don't eat cow meat. Beef. They don't, because they are feeling that if there is a monkeypox, then of course it will also translate to cowpox. You know,
but there is cowpox.
There is,
but it is there's no way monkeypox can become cowpox.
No. So as it is now, we want to encourage the government, you know, through the office of the Minister for Health, but at least he can still do more for us. Okay. He is doing, but he can still do more for us.
Okay.
At least translating this into local languages and getting to the grassroots.
Maxwell in Ghana. Good morning, sir.
Good morning, Uncle Yori, and good morning to gentlemen you have in the studio there.
Thank you.
Good morning.
Good morning.
I am, in fact, the ball, let me just say the big job of curtailing any these transferable diseases is with the government. The government is not paying much attention, and the more budget has not been allocated to the health department ministry. They cannot conduct researches. They cannot provide, even go into invention of vaccines. We only react this fire brigade attitude of our government. Our government is not helping matters. They should be proactive in all these things so that Nigerians, in fact, I agree with Mazo Kurafo. 70% of our Nigerian people have no access to electricity. How then can they listen to information passed by in radios and so on and so forth? It is not possible. And that is why so many people are dying. That is why so many people would deceive others that soldiers are injecting, let me just say, the monkeypox thing to their wards in school. That is lack of information. There is a total breakdown in the information system in Nigeria, Uncle Yori. The earlier all these things are addressed, the better for Nigeria. Otherwise, as I said yesterday, Nigeria is becoming a failed state. With all these things that is happening, Nigeria is becoming a big nation with such, kind of biggest economy in Africa. Even, I think, 29th or 25th in the world. You cannot provide for your people ordinary dissemination of information. They cannot.
Okay.
It is a disgrace.
Okay, Mr. Maxwell.
Have a wonderful day.
Indeed. Thank you very much for calling in. Today, your thoughts on how well the work of spreading information, the news is going. Yes, we have a better internet penetration, but the point is made that never mind internet. It's what our penetration. So I think I was reading a figure as far as our phones go, somewhere in the region of maybe something like 15 million or something like that only. So, do you agree that government is not reacting to this as effectively as it could, especially in the door-to-door that Dr. Oga was suggesting, where people are sort of explained to especially what we've just heard, that people might not have known that it's called monkeypox, all right, but generally speaking, it could be a monkey or rodents, for example, and it will still be monkeypox. And so people might say, oh, we don't have any monkeys here, so we're safe. But actually, if they knew the additional, what Dr. Oga has told us, you know, are you satisfied that government has done the best that it could, or it's an ongoing, because one doesn't want to be slamming government every now and again, but still, they have to be up and doing.
Yeah, honestly, I'm not satisfied. As a Nigerian, we go to all these hospitals all the time, we go to all these ministries all the time, and we know what is happening in most of these places. Take, for example, the example doctor has mentioned here, when we had Ebola in Lagos State, if not for the proactive activity of the Lagos State government, the calamity would have been far more than that. The people in Abuja... So
it was leadership that came out there.
The people leadership. In Abuja, exactly. The people in Abuja just sat over there. They even shut down the people in Lagos. They said the people in Lagos, the minister, the commissioner for health, and all the medical people who are handling the matter in Lagos should not address the press. The minister of health who was in Abuja, who was doing little or nothing about the Ebola, the containment of Ebola in Lagos, they said he was going to be all the speaking. So they saw it as a political opportunity to make a point. Whereas this is an health challenge that should be addressed as well. And we shouldn't find ourselves in this kind of challenges or situation. In the sense that when you look at Nigeria today, it has one of the best media structures in the whole of Africa. Highest number of radio stations, highest number of television stations, highest number of newspapers and whatever. So it should be so easy for us to communicate with the people at the grassroots all the time. But because of the lethargy, as we see in education, as we see in industry, as we see in banking, that is what also has permitted also the health sector of the economy, so that when there are little challenges like this, we are not proactive enough, and we are not addressing it as much as we should address.
Waiting to join this conversation also, sorry about that, waiting to join us is Ayo in Birinin Kebbi. Good morning, Ayo.
Hello.
Good morning, thank you for coming.
Good morning.
Good morning, sir. Please go ahead. That was the network. See if you can get in again, Ayo. Even if I'm speaking, I'll interrupt myself mid-sentence. Ayo in Birinin Kebbi, see if you can get in again.
I think this also has to do with funding. Because for example, somebody called and said he thought the Minister of Health is not doing it. I don't think so. Professor Adewale is a medical doctor, a professor of medicine and all that. So he knows what it takes to really do some of these things. But if all these ministries are not being properly funded, there's little or nothing anybody can do about it. Not too long ago, the wife of the president came out and said, even the Aso Rock Clinic, we should have the best facilities in the country compared to some of, like we should have in some of these university teaching hospitals and all that. Does not even have syringes and cotton balls and all that to really take care of the people.
It still goes back to leadership.
Yes,
it still goes back to leadership because, I understand that we have inadequate supplies in some instances, but as you are saying, for someone to have been able to factually report that even syringes are lacking just goes to show that there's absolutely no one taking charge there. We might not be able to afford, the latest cutting-edge machines or whatever, but not syringes. It just goes to show you the state that everything has gone to. Good morning, Yakub.
Good morning, Shidori.
Thank you for calling in.
And then good morning to the guys in the studio.
Good morning, sir.
I think this is an educative program. Because of the gentleman at my right side, I want to
Dr.
ask
Oga?
a question. Yes.
Yeah.
Shidori, I want to ask the Dr. Oga a question. The question is that, is there anything called monkeypox vaccine at all, right from the first place? Rather than some people somewhere beginning to break out a rumor, and then to the extent people are now going to the school to withdraw their children. And then
Yakub, have you just joined us?
Yeah, no.
We were together from the beginning of the program.
Yeah, because
this ground has been covered.
Other media station whereby a doctor said there is no anything called vaccine for monkeypox. Are you getting me, sir? So I want to know, maybe is it true or not?
There is no cure. There is no known cure. Dr. Oga has spoken about that. Work is ongoing.
Okay.
The virus will spend itself out when you are quarantined away.
Okay.
And that's how he explained that.
Thank you. Now I get it. Thank you and God bless you.
Okay. Very much. Thank you very much.
So there is something I want to chip in from the last conversation. Yes. You see, funding is one, agreed. And then leadership is another. But again, our value system as a people, you know, it's alarming when you work within the health sector. You see that somebody will have to come to the hospital when he or she, it dawns on the person that all is almost over.
Yeah.
Are you get what I'm saying?
Yes.
So at that point, the hospital or the government have tried to come up with the hair care centers, at least very close.
From the first place. Rather than some people somewhere beginning to break out a rumor, and then to the extent people are now going to the school to withdraw their children. And
Yakub, have you just joined us?
Yeah, no.
We were together from the beginning of the program.
Yeah, because I
this ground has been covered.
Other media station whereby a doctor said there is no anything called vaccine for monkeypox. Are you getting me, sir? So I want to know, maybe is it true or not?
There is no cure. There is no known cure. Dr. Oga has spoken about that. Work is ongoing.
Okay.
The virus will spend itself out when you are quarantined away.
Okay.
And that's how he explained that.
Thank you. Now I get it. Thank you and God bless you.
Okay. Very much. Thank you very much.
So there's something I want to chip in from the last conversation.
Okay.
Yes. You see, funding is one, agreed. And then leadership is another. But again, our value system as a people, you know, it's alarming when you work within the health sector. You see that somebody will have to come to the hospital when he or she, it dawns on the person that all is almost over.
Yeah.
Are you get what I'm saying?
Yeah.
So at that point, the hospital or the government have tried to come up with the hair care centers, at least very close to you. And I was giving a lecture somewhere in Benue State last week where they were asking about a partial stroke and a group of bankers. And I was talking to them and all of them were like, wow, so the symptoms they are seeing in them is partial stroke on the way. Yeah, by the time
but a lack of knowledge.
Lack of knowledge and lack of not giving your health this level of alertness and seriousness, you know, until it has deteriorated to a certain level where you cannot, you know. So while we look at the aspect of government giving us funding, putting quality leadership in place, we should also look at the value system.
Indeed.
You know, we will look at it.
And so that we can then prioritize.
You will prioritize, you know.
Because we might not be able to afford cutting-edge medical supplies. You can see some pictures of the effect of the mature, you know, monkeypox. Whereas we might not have all the very, very latest and all of that. This prioritizing comes in. We can at least get the word through to people to watch out for this so that, don't become a patient. We might not be able to. Don't become a patient should be the emphasis where you can't buy that which is needed. So maybe that's where the experts, especially take the report that Mr. Isiaka in Boko gave us, you know, that he doesn't feel people are knocking on doors enough, going to the, if you want to call them that, illiterate folks and explaining to them. For example, what we have heard on the program, many people might have known it before, that yes, it is monkeypox, but rodents, rats, any rodent generally could also transmit it. Squirrels, and these are bushmeats to our people. So a man might not have come in contact with a monkey in the last 10 years, but he doesn't joke with his squirrel delicacies, for example. And he feels that nothing, I don't have any connection with monkeypox. Where will I see it? These are very, very commonsensical things. I don't know. It surely must be less expensive to get people to go knock on doors if that's what it's going to take. Because Mazi Okorafa was pointing out that where is the power going on for radio, TV, and all of it? Some people don't even, but I think it's a point well made by Isaka calling in from Boko State earlier. And Mr. George had called in and said that he's not impressed, you know, particularly with the speed with which, maybe he was comparing with Lagos and the way it reacted to Ebola. And everybody commended that. Even the federal government of the time had to grudgingly acknowledge, even as Lagos at the time was saying, okay, it doesn't really matter, just whatever, we know that we've kept our environment safe. And Bola from Lagos Island, for instance, good morning. Did you want to continue with that thread? Bolahan in Lagos Island. Good morning, sir.
Good morning.
Okay, we're waiting for you. Go ahead, please.
Yeah, Uncle Yori, thank you very much. One, there is one thing I believe the federal government should do. What is the job of the National Orientation Agency in all this?
We're talking about monkeypox.
Yes.
Okay.
It's their duty to do that as well, to disseminate information. And what is the job of the Federal Minister of Information as well? Yes, I know. If they're disseminating the information, getting closer to the people, information is very key in this.
Okay, we lost you, but I would imagine that you're right, because we started off by saying, as you remember, the Minister of Health was quoting 7 states affected, 33 cases. Now we are speaking of 11 states and 74 suspected cases. But when you look at the story under those headlines, you see that all the scientists and all the doctors are still conducting these tests, and not all of those tests are coming through as positive. You know, so it all comes back to this whole knowledge base. Dr. Oga explained that
the symptoms are similar with other viruses. So when you see cases, you try to follow the pathology and be sure that that is monkeypox.
So it could be a suspected case of monkeypox,
yes.
But then it might be medically discharged and acquitted.
Of course.
You know. So we say, no, that is not the case. Ekanem in Yaoundé, good morning.
Good morning, Uncle Yori.
Thank you very much for calling in. Go ahead, please.
I'm so pleased to be following you up every day in your program. God will bless you mightily.
Thank you very, very much. Thank you
very
much.
I want to tell you that even though I'm getting you here in Yaoundé, it's because we have 24 hours of electricity. And you don't expect Nigeria, who do not have electricity, to be following all what you are discussing. In fact, it is impossible. That is why Nigeria will always be having all these type of problems. No country will survive with generators. It's impossible. You are doing business to use generator. You want big companies to come in to develop your place to use generator. It's impossible. I have even been trying to bring in companies there, but because of your epileptic electricity that you have there in that country, nothing can work. Now you are talking to the people only in maybe Lagos and Abuja. What of the people in Etina? What of Uyo? What of Abachileke? Right now, as I'm talking to you, I'm the one who informed my people in Etina that they should be careful. There is another outbreak of such a disease.
Okay.
So I'm sorry. Try to bring up your electricity so that you will not be even wasting time talking every day.
Okay,
no,
but Mr. Kanem
will survive without electricity.
Okay, Mr. Kanem, just before you go, Mr. Kanem, you there?
Yes, I'm there.
So is that why you ran away to Yaoundé? Because of electricity?
Yes, I'm telling you, that's why. How can I be...
Okay, thank you very much then. So, because he was now using phrases like that your country. It's still Kanem's country now. But he now says, but the man said, well, electricity is part of why he ran away to Yaoundé. Now we have to fix. It's an important point he's making. But you see, word gets around many sorts of ways. Yes, there's a very structured way, but he is saying that he is the person now having to call his own people, say, look,
all the way from
Yaoundé for something. So there's this aspect of it that I imagine the authorities are also well aware of. People have introduced the last gentleman that called said, look, don't let the National Orientation Agency off. They themselves are slack. What is the Minister of Information doing? Well, they've been doing quite a bit. They were the people that came out first, I imagine. I remember with this whole matter about this rumor, this horrible rumor about the military being trying to spread this thing, this is not all those mad scientists from World War II, anti-Semitic scientists experimenting unconscionably with human beings. But I was just told that there's someone else on the line. Good morning, Samson in Wari.
Good morning, Professor Uncle Yori. And good morning to my co-panelists.
Okay.
Good morning.
Good morning.
Uncle Yori, the last person that called has said it all. Do you know that I've been running a generator for the past 2 hours just to watch your program?
But at least you didn't run away. Samson, you are here.
Yeah, sir. No, I'm here now. I'm in worry. I'm still giving you fuel. Giving you gas. You are not giving me power. Now, let us check something right very well. You see, the problem, or the whole problem is highly political. You can see, most of our politicians, they have a problem. Let me give you, go to your area, like Ugeli, Patani, lots, Papele or something. Politicians go in there to go and campaign. During the election, you see that they are very vibrant. They will go in there to go and seek for their vote. But when it comes to information, dissemination of information, they are there zero. I was in the market yesterday. Do you know that most people don't even buy cow meat again now? People buy fish. But very soon, maybe we are going to have fish pox. We don't say we have fish pox.
Yes.
When you have fish pox, forget it. We'll be eating all alone. So you cannot be governing a state or a country without information, which is the vital. And I was the one cancelling them in the market yesterday. I think I'm the counselor. I gave them the good information about the monkeypox, what they can do, wash your hands regularly. When your children come, I'm telling you, they don't take this thing to the local government. They only go, wait till by this time next year, we will see them by the marketplaces seeking for election, giving them money, giving them values. But we have told the people now we are going to stop it. So good morning, Uncle Yoli.
Thank you very much for calling in, indeed, and good morning to you. Well, we've spent our time as a more fact, but I think it's been very useful. I certainly have learned a lot from Dr. Oga in terms of, what it is and what is being done about it, and even that there's more than one strain, and but also that it's much milder than chickenpox that we know. Nevertheless, it doesn't mean that you can't manage it at all. There's no known treatment. It shall have to spend itself out and all of that. And also, very, very importantly, even though it is monkeypox, rat fit give them, squirrels fit give them,
antelopes,
and all of these are delicacies, bushmeat delicacies. But an antelope is not a rodent.
Yeah, it's not a rodent, but it's a bush animal.
So one probably is safer for now saying, forget bush meat. Generally speaking, let's just do with beef. Even as we were being told by our brother there from Wari that even cow meat, people are sort of abandoning it. And he said, I hope we don't get to fish pox. I want to thank you very much, gentlemen. Thank you, Dr. Emmanuel Oga, public health expert. Thank you very much for coming. And also, Mr. Tunde Kolawole, public affairs analyst and
Thanks for having me.
Thank you very much
for having us. Yes.
So that's our program. Join us on Monday for a fresh edition. We don't go out on Saturdays and Sundays. All being well, I'll see you on Monday. I'm Yori Folani. Have a great weekend.